Well, I had my first attack when I was 19 years old. First, got a chest infection that I went to my doctors and I was given the wrong antibiotics and it triggered off my first porphyria attack. In 5 years, I've had 21 attacks and they range from 2 weeks apart to maybe a year apart, depending on how well I'm doing at the time. But during attacks, they're really painful. You don't want people to touch you. It's like you just want the pain to stop and you just don't want to be here. You just want it all to end. However that end is, you don't want to be in that situation. In between attacks, I suffered with chronic pain. So maybe half the week's good, half the week's bad. And it is upsetting because I can't always go out and do the things I want to do. So I always have to think what the consequences might be if I was to do that action or that activity, because it is physically and mentally draining. I really like to travel. I'd really like to go to different countries and see different things, but I couldn't do that because I have treatment once a week. Every day I take probably about 3 meds in the morning and 5 tablets in the evening, just to make sure I manage my pain, make sure I sleep, make sure I can get up in the morning the next day to carry on, because it is so painful and the opiates don't always cut it. The pain without the opioids is indescribable. You can't move, you don't want people to touch you. It's just horrible. It is really hard to explain. It's a burning pain, like a fire that you just can't get rid of. It's really dull, really sharp. And when you're on the opioids, the sharpness goes, but the dullness always stays. I ended up with nerve damage a couple of years ago and I ended up paralysed. I ended up having to learn to walk again, to climb stairs again, and that was down to nerve damage that the porphyria had done. And even to this day it affects me, that if I'm having a bad day I'll have to use crutches. I might trip, I might fall, because my brain thinks I've taken a step and actually I haven't. I think the impact is really hard on my family, especially my mum and my brother that see it every day. If it wasn't for my mum and stuff, I think it'd be really hard. You take every day as it comes and you do hope that you have a future, you do hope you don't get really ill. But obviously every time you go into hospital there's always a risk that you might not come out because it is so severe. So you've always got to take every day as it comes and hope that you'll get through the attack with your friends, your family, the medication, the doctors, so you can carry on and have a future. I think it's important that we raise awareness for other patients and raise awareness to show people that we are suffering but we do need help. My name's Alicia and I suffer with acute intermittent porphyria.